Hello everyone, this is your teacher Rashid Wazian. Welcome to a new lesson, and today's lesson is communication, asking for advice and giving advice. So when you are ready, let's begin. Okay, let's start with some vocabulary. Health problems. Match the illnesses through the photos. You have a set of photos, try to match them with the words that go with them. Let's start with the first word, headache. Who's got a headache? Nice. It's 1B, the boy who's holding his head. Let's go with the second word, a fever. Who's got a fever? Okay, have you figured it out? Nice. It's 2B, the girl who's in bed and apparently her temperature is high. A stomach ache. Who's holding his stomach? Because he's in pain. Nice. It's 3A, the girl who's holding her stomach. A toothache. Who's got a toothache? Nice. So it's the little girl who's holding her jaw because her tooth is aching. A cough. Who's coughing in the pictures? Right. Excellent. It's the boy. And I'm sure you have figured out the last one, which is the flu, and it's the F, which is the boy who's, of course, sneezing. Great job. Now let's move on. We're gonna see together some expressions that we use to give advice and ask for advice. Okay, we're gonna read two dialogues, and your task is to find expressions of asking advice and giving advice. Let's go with the first dialogue. Okay, allow me to read it for you. A. What's the matter? B. Oh, I have a headache. What should I do? A. I think you should take a painkiller and you shouldn't go to the party. B. Oh, I guess you're right. Okay, did use the expressions of asking for advice, and giving advice? Right, excellent. The first one is what should I do? This is an expression that we use to ask for advice. What about other expressions? Excellent. I think you should take painkillers, which is an expression that we use to give advice. Is there any other expressions? Excellent. You shouldn't go to the party. Again, is another expression that we use to give someone's advice. Perfect. Now let's see the second dialogue. Allow me to read it for you. Are you okay? A. A. Are you okay? B. Oh, I have the flu. I don't know what to do. A. You shouldn't go out. You should drink a lot of warm fluids and you should stay warm. B. Thanks, Mom. I'm sure by now you have figured out the expressions. The first expression, which is I don't know what to do, it's for asking for advice. The boy is asking his mother for advice. And now the mother gives her child advice and she goes, you shouldn't go out. So she uses you shouldn't go out. And you should drink a lot of warm fluids. And you should stay warm. Right. Perfect. I'm sure now you have understood these expressions that we use for asking advice and giving advice. Now let's uncover more expressions together. So here are some expressions we can use to ask about health, ask for advice, and give advice. Expressions that you can use to ask for health are like, how are you doing? What's the matter? How are you feeling? Are you feeling better? What's wrong with you? Are you okay? Now, expressions that we use to ask for advice. What should I do? What do you think I should do? What can I do? What do you advise me to do? Great. Now, expressions that we can use to give advice are the following. I think you should. I don't think you should. You shouldn't. You ought to. You would better. If I were you, I would. Nice. You can please copy these expressions in your copybook and try to use them in various sentences. Right. Now, time to practice. So, use should or shouldn't to complete the sentences. Tips to protect yourself from the new coronavirus. Take your time to read the sentences, pause the video, do the exercise, then press play to see your answers. Right, so answers time. So check your answers. So first answer is you should wash your hands with soap and water. Second right answer is you shouldn't shake hands with people. The third sentence, you should stay at home. 4, you should take care of your health. And 5, you shouldn't touch your face with your hands. And number 6, which is a small dialogue. And A, I touch an infected area with my hands. What should I do? He's asking for advice. So you said, what should I do? And B, who is going to give him advice, goes, you should wash your hands with soup immediately. Perfect. I'm sure you have done a great job with this exercise. All right, role play. First of all, have a look at this picture. What do you see? There is a doctor and there is a patient, and apparently they are having a conversation. Okay, your task is you are a patient. Tell the doctor how you feel and ask for advice. And you are the doctor. You give patients some advice. So you're gonna work in peer. One of you is the doctor and the other is the patient. So you pause the video, you try to come up with a short dialogue, then you press play to see the dialogue that I have prepared, which I'm sure will look exactly like the one you have prepared. Okay, the dialogue. So the dialogue that you have prepared should look similar to this. So the doctor would say, how are you feeling? The patient, I have a cough and a fever. I ache all over. What should I do? Doctor, oh, you have a cold. You should stay in bed and rest. You shouldn't eat anything until the fever goes down. Patient, okay, doctor, thanks. I'm sure you have used expressions that we have seen, of course, before to construct your dialogue. So, as a doctor, you give the advice, and as a patient, you ask for the advice. Great. So, I'm sure you have managed to come up with great dialogues. Okay, perfect. So I would like to thank you for your patience and still, of course, you can use the expressions we have seen today to advise your families and beloved ones to take the necessary precautions to prevent themselves from the coronavirus. And don't forget to use the right expressions that you have seen earlier. So I would like to thank you so much for your patience, and I'm looking forward to seeing you in another lesson. For now, have a wonderful day, and thank you so much. Bye bye.